Understanding safe days in the menstrual cycle is crucial for those looking to either prevent pregnancy naturally or to improve their fertility awareness. Safe days refer to the period in a woman's cycle when the chances of conception are at their lowest. However, tracking them requires a good understanding of the menstrual cycle and its phases, and that is why I'm here to keep you informed. Let's get into it after the break. A typical menstrual cycle lasts 28 days but can range anywhere between 21 to 35 days in different individuals. The cycle is divided into 4 main phases, and I want us to go through them one by one. So the first phase is the menstrual phase. This should occur for around 5 days, and normal menstruation should be between 3 to 5 days, but in some individuals it goes beyond the 5th day landmark. Others goes beyond up to the 7th day, and some may be beyond the 7th day, and that is where the problem comes. So any menstruation that exceeds the 7th day should be considered as a disorder of menstruation, and the patient should consider seeking medical attention. So the second phase is the follicular phase. This is also called the pre-ovulatory period. It is the period before ovulation, between menstruation and ovulation. So the follicle stimulating hormone usually increases in amount during this period, and the body prepares for ovulation by producing follicles, with one maturing into an egg. So the estrogen levels also rise during this period. And the third phase is the ovulation period. This occurs on day 14. It is the most fertile period. So if you really want to be sure of getting pregnant, this is one of the days you should engage in that activity. So the ovary releases an egg during this period, and this egg usually remains viable for 12 to 24 hours. Sometimes the ovulatory phase goes beyond the day 16, so it could go up to the from the 14th, the 15th, and sometimes the 16th day the eggs are still produced. So after the ovulatory phase, we have the last phase, which is the luteal phase, also called the post-ovulatory period. This is the period where, if fertilization does not occur, the hormones drop in level and the body prepares for the next menstruation. So let's just recap these 4 phases. This is the easiest way to have a proper understanding of them. So the first, we have 2 main landmarks, which is first is menstruation, and then the other is ovulation. You have to know that you have to count your days from the day of menstruation, day 1. So menstruation is point 1, and that is day 1, and then ovulation usually occurs at day 14. So in between these 2 phases are 2 other phases, which is the pre-ovulatory phase, also called the follicular phase, and then the post-ovulatory phase, also called the luteal phase. So we have safe days in between these 2 phases. All of them have safe days, and then you have to understand when are the fertile days. So any day that is not safe is definitely a fertile day. Another thing that is important to note is that a sperm has a lifespan of 5 days. So if it is deposited into a woman's system 5 days before ovulation, the woman will get pregnant. So the safest point is to ensure that this sperm does not go into your system at least 6 days before the ovulation period. So 6 days before ovulation is the last safe day. So let's count. 6 minus 14, which is the last day of ovulation, that gives us 8. So this means from day 1 to day 8 you are safe. But of course we know day 1, day 2, and highly likely day 3 in most women, you are menstruating, so you should not have sex during menstruation. That is according to the Bible, but I know some of you do it anyway. From day 1 to day 8 you are safe. Whether you want to do it during that time or not is up to you, but day 1 to day 8 is a very safe day. Now from day 9 to day 14, the sperm may be deposited, but it will still live until the 14th day when the eggs are produced, and that means it will be fertilized and you will get pregnant. Again, eggs are produced also on the 15th day and sometimes on the 16th day. This also means that any day, any sex or any intercourse that occurs from day 16 to 12 and around 24 hours after day 16. This is because an egg has a lifespan of around 12 to 24 hours, so we still assume it will be viable for fertilization until day number 17 because of the 24-hour period. So this means the next safe day from the time you ovulate is on day number 18. That is a period when the egg has died, and again any sperm deposited will not be fertilized. Isn't that simple? Now there are very many contraindications to this. If you really don't have a regular cycle, then you should not try this. Again, try to track it on a calendar, and also monitor your body temperatures. They usually give you warnings, especially when you're ovulating. The temperatures go slightly higher. And then also check the cervical mucus during the ovulatory period. The levels of cervical mucus increases, and that may help you understand your fertility. And then the limitations of this day, of course, irregularity of the cycle, and then of course you really need to do strict monitoring while practicing the safe days. If you have any questions on the safe days, feel free to ask us at the Medifield Healthcare, and remember to subscribe to our pages and follow us and subscribe to our YouTube channel. Thank you for listening.